I started off as a general practitioner, and went into clinical medicine with all the passion of, wanting to help, wanting to serve. And I think we all go into careers for what we think is the same reason. And once you get into it, you actually find that there's different parts of it that you want to take away from it. As much as you think you go into it as a calling because you want to help people, when you're actually now sitting in front of people and thinking, how do I help?
Yes.
Because there's various components of now assisting the individual.
Yeah.
And as a GP, I found that, it was more complex than I had anticipated. I was the social worker, the financial advisor, the legal advisor, and I found that quite overwhelming. And I still wanted, I still had the passion to help people, and decided maybe this is not quite the forum or the platform I want to use to help people with all the skills and knowledge I've got. And I actually went into corporate quite early on in my career. And I decided to go into the pharmaceutical industry, purely driven by intrigue. I had been involved in clinical trials as a general practitioner. And I got fascinated, by the behind the scenes, because this was still part of the helping, the medical research, the expertise, how do you actually finally narrow it down to that one molecule that is going to make it to be the drug, whether it's for hypertension. Absolutely,
so on, right?
That really fascinated me. And I looked into that, and I was fortunate at the time. There was quite a big drive of actually, transforming the pharmaceutical industry in terms of recruiting black professionals into the industry and training them up, They didn't expect us to have the skill or anything. And I was recruited into Merck Sharp and Dome at the time, and I had a fantastic time, I went through the various departments. I went into marketing, into the regulatory space, and I ended up in medical affairs. And it was really an exciting time, and I got to hone in a lot of the various, disease areas, what my husband would later call me a cardiovascular expert. Say, if you want to know anything cardiovascular, speak to that lady. So it was exciting, and I was interacting with patients because they were calling in, asking about their drugs, the side effects they were experiencing, interacting with doctors in terms of setting up their practices as clinical research sites. And it was, it was really amazing. So I spent a lot of time in the pharma industry. I later went on to work for GlaxoSmithKline, where I think really my career really took off, and I had a more continental and global role in terms of looking after a number of developing countries around the world, including the Middle East, Asia Pacific. And it was really more looking at those different hows of how to help the people, going into markets where you've actually never managed to get a drug delivered into that village, or that patient can only afford to actually buy one dose at a time.
So access is a real issue in these environments.
Yes, and looking at, you want to introduce a new vaccine, but it needs what you call cold supply chain, so you get into that village when they don't have a stable power supply, and then you want to put in a fridge with a vaccine, so all those intricacies, and so it's really been a very exciting journey, going into the world, looking at various parts, looking at various countries, different cultures, and different practices around the world. And while all that was exciting, I had 3 children who were quite young and who were asking for mom. Life was becoming a little bit more difficult for the older ones that were going into teenagehood. And there was a big call in the household for mom, to stop packing the suitcase and really come back home. So I explored, what I could do locally, setting up my own company, doing what. I started thinking, I'm not really an entrepreneur, To myself, I convinced myself I was a scientist at heart. I needed to be in an environment, that's like setup, working, buzzing, all these exciting things to do. But then I started thinking, no, let me look at something to do for myself, and hopefully as equally fulfilling. And then that's when, in 2014, I left GlaxoSmithKline to start up what I always say to people is a small spaza shop with a partner of mine, where we managed to buy some healthcare assets that were being sold. And I found myself in the private healthcare sector, hospital environment. It was a different scene, I must say. You know, I had interacted with nurses as partners and as colleagues in the workplace. You know, having to employ them and listen to all their issues was a different ball game altogether. But it was really part of setting up that small group that has now since grown. You know, like really looking at different aspects of how you could make this a different entity. What would be your competitive advantage? There were already players in the market. What would you do differently? How are you expecting to grow this company and ensure that there is sustainability? You know, so it was all those exciting things that, you know, were like stimulating me, you know, dealing with the regulators all over again, you know, trying to get licenses sorted and all of that. And it was great. I mean, it was going well. And one day I got a phone call, you know, would you be keen in coming to head up the Nelson Mandela Children's Hospital? I mean, I was totally baffled. I'm like, why? You know, and the first call was like, no, I don't think so. I don't think so. I'm good. And I think I'm happy that person kind of persisted,
and said,
you know, and gave me a call like, so no, we'll just send you the job spec, have a look at it, tell us what you think, you know, and I got the job spec, I looked at it, I was like, whatever, you know, but I think the more I sat down, I digested it. I had known about the project for a long time. And I kind of had an idea of where it was in terms of, you know, it was fully built and, you know, it was just about to take off, you know, and I really thought long and hard about, you know, what could you contribute, you know, to ensure the success of this institution.
Right.
But most importantly, this comes with a huge responsibility. You know, this is a Nelson Mandela legacy. Girl, you can't get it wrong, you know, and all of that. But at the same time, that excitement of being, you know, one of the first people who got this thing going, you know, I think is what stimulated me and excited me and got me thinking, no, I mean, I think we could set up a brilliant team to get this thing off the ground. We wanted to lie there and think, I'm good, I've got the right people, you know, sort of doing this. So that's how I ended up here.